England's NHS facing worst staff crisis in entire history as exhausted workers quit in droves.
WHO declares monkeypox a public health emergency.
Girl receives heart transplant after 2-year wait.
Tattoo addict, who has transformed into black alien, wants to amputate his leg.
Tanzania bans popular sex enhancement herbal drug.
4th patient seemingly cured of HIV.
30 India students vaccinated with 1 syringe.
COVID origin studies say evidence points to Wuhan market.
At least 43 abortion clinics shut in a month after Supreme Court overturned Roe, research says. England's NHS facing worst staff crisis in entire history as exhausted workers quit in droves. The Conservatives have been accused of doing nothing as the NHS in England faces a staffing crisis, with an exodus of workers jeopardising patient safety. According to a damning report, the service is facing the worst shortages in its 74-year history, in every department. In a stinging attack, it slammed Number 10's pitiful response to the crisis, revealing Boris Johnson has no plan to deal with it. Health officials have warned that the situation could jeopardize the effort to clear the COVID backlog. According to the Nuffield Trust, after 12 years of pay freezes and paltry raises, there is a shortage of 12,000 hospital doctors and more than 50,000 nurses and midwives.
WHO declares monkeypox a public health emergency. The World Health Organization has declared the monkeypox outbreak a global health emergency. The classification is the highest level of alert that the WHO can issue, and comes in the wake of a worldwide increase in cases. It came at the conclusion of the WHO's Emergency Committee on the virus's second meeting. According to WHO Director General Dr. Tedros Adhanom Ghebreyesus, more than 16,000 cases have been reported from 75 countries. He added that 5 people had died as a result of the outbreak. There are currently only 2 such health emergencies: the coronavirus pandemic and the ongoing effort to eradicate polio.
Girl receives heart transplant after 2-year wait. A 2-year-old girl who was the first in the UK to use a mobile heart to allow her time away from the hospital has finally received a transplant. Grace Westwood, from Birmingham, had been alive with an artificial organ for more than 2 years while waiting for a donor. After a match was found, she underwent the 12-hour operation at Newcastle's Freeman Hospital. Saying thank you just wasn't enough for the donor family, according to her parents. Becky Jones, Grace's mother, stated, "It's really hard. How do you put into words the gift they've given us? They've lost a child and have given us so much." Grace was born in November 2019 with a defect in her left ventricle and became critically ill in March 2020. Now that the toddler has received a donor heart, the family is looking forward to the future.
Tattoo addict, who has transformed into black alien, wants to amputate his leg. A tattoo addict, who is attempting to transform himself into a black alien, now wishes to amputate one of his legs. Anthony Lofredo, 33, of France, has already had his nose, both ears, and 2 fingers amputated. His upper lip has also been nearly completely removed, making him unable to speak. He's also had numerous implants implanted beneath his skin, which is almost entirely tattooed black, as are his eyeballs. The body modification addict's tongue has also been split, and a hole cut through the skin below his bottom lip. Lofredo revealed on the Club 113 podcast that his extreme appearance has made it difficult for him to find work. When asked if he has ever kept any of his amputated body parts, he said, "My ears, my friends keep them."
Tanzania bans popular sex enhancement herbal drug. Tanzania's health authorities have prohibited the use of henshaw, a popular traditional herbal treatment sold on the basis that it improved male sexual performance. Professor Hamisai Malibo, chairman of the Traditional and Alternative Health Practice Council, stated that the decision to ban it was based on recent investigations. He claimed that laboratory tests on the herbal compound revealed it contained elements of the drug sildenafil, better known as Viagra. He claimed that henshaw was unsafe and that its producer did not follow council regulations. The herbal powder is typically made from a combination of the leaves, roots, and bark of the mokongo tree, which grows in East Africa. Other manufacturers sell it under various brand names. Henshaw producers have been instructed to remove the product from the market immediately. Professor Malepo stated that promoting traditional medicines, herbs, or alternative drugs without the Council's registration and certification is an offense. Tanzania promotes the use of traditional medicine and has approved the sale and use of 5 traditional treatments to improve sexual performance in the market in 2020.
4th patient seemingly cured of HIV. According to doctors, a man who has lived with HIV since the 1980s appears to have been cured in only the 4th of such case. He received a bone marrow transplant from a donor who was naturally resistant to the virus to treat blood cancer leukemia. The 66-year-old, who wishes to remain anonymous, has stopped taking HIV medication. He said he was beyond grateful that the virus was no longer present in his body. The man is known as the City of Hope patient, after the Duarte, California hospital where he was treated. Many of his friends died from HIV in the days before antiretroviral drugs could extend people's lives to near-normal levels.
30 India students vaccinated with 1 syringe. According in the central Indian state of Madhya Pradesh, a health official is being investigated for vaccinating 30 students with a single syringe. The incident occurred at a school in the Sagar district where children were receiving COVID-19 vaccines. For COVID-19 vaccines, India's health ministry requires a 1 needle, 1 syringe, only once protocol. So far, India has administered over 2.03 billion COVID-19 vaccines. In India, single-use disposable syringes are widely used to prevent the spread of deadly diseases such as HIV. However, due to a lack of equipment, a single syringe has been reused in hospitals on multiple occasions in the past. Jitendra Rai, who was vaccinating the children, told the media that the health department only gave him 1 syringe and he was just following orders. Parents who had accompanied their children noticed the problem and reported it to school officials. When state officials arrived at the school, Mr. Rai was nowhere to be found, and his phone had been turned off. The state's health department has filed a negligence case against him. Meanwhile, an investigation has been launched against the official in charge of dispatching equipment for the vaccination drive.
COVID origin studies say evidence points to Wuhan market. Scientists say there is compelling evidence that the COVID-19 outbreak originated in Wuhan's Huanan seafood and wildlife market. 2 peer-reviewed studies published on Tuesday re-examined data from the city's initial outbreak. According to one of the studies, the earliest known cases were concentrated around that market. The other uses genetic data to track the outbreak's timing. It appears that 2 variants were introduced into humans in November or early December 2019. According to the researchers, the evidence suggests that SARS-CoV-2 was present in live mammals sold at the Huanan market in late 2019. They claim it was transmitted to people working or shopping there in 2 separate spillover events, where a human contracted the virus from an animal. Professor David Robertson of the University of Glasgow, one of the researchers involved, told BBC News that he hoped the studies would correct the false record that the virus came from a lab.
At least 43 abortion clinics shut in a month after Supreme Court overturned Roe, research says. According to new research, at least 43 abortion clinics have closed their doors in the 30 days since the U.S. Supreme Court overturned Roe v. Wade in June. The Guttmacher Institute, a research and policy organization focused on sexual and reproductive health that supports abortion rights, published the findings on Thursday. The closures are concentrated in the South and Midwest, where abortion is illegal or severely restricted. Guttmacher predicts that the already dire state of abortion access will worsen as more states ban abortion in the coming weeks and months.
For your daily global health news, visit www.StayWellWorld.org. Please do well to subscribe, like, share and comment. If you've already subscribed, turn on the notification icon. so you don't miss any update. Thank you for watching.